Welcome to this episode of the New Jersey Axe Team Science Virtual Seminar Series, sponsored by NJ Axe Team Science Corps. My name is Dan Horton. I am one of the co-leaders of the Team Science Corps, along with Nancy Reichman and Ralph Gelati. As a reminder, this virtual seminar series features biomedical research teams and leaders across the NJ Axe Consortium who are performing high-impact, multidisciplinary, and transdisciplinary research projects, including projects funded by large federal grants or foundation grants, or sometimes all of the above, as in today's featured project. We asked the guests to provide a high-level overview of their teams and their projects, and then to comment on different aspects of team-based research, so we can all learn from their successes as well as the challenges that they've faced and overcome. So I'm going to turn over to Ralph to introduce today's guest.
Excellent. Thanks, Dan. It's my pleasure to introduce our guest, Associate Professor of Communication, Dr. Katherine Ognyanova. Katherine studies the effects of social influence on civic and political behavior, confidence in institutions, information exposure and evaluation, and public opinion formation. Her recent work examines the links between misinformation exposure and political trust. Dr. Ognyanova is one of the founders and a principal investigator for the COVID States Project, which we'll be hearing about today, which is a large multi-university initiative exploring the social and political implications of the COVID-19 pandemic. So Katya, great to see you. Thanks for being with us today.
Good to see you all, and thanks so much for inviting me. And I'm excited to have a chance to talk to you about this project and about our team. I think we've built a really interesting configuration there, and I'm happy to have a chance to share it. So let me share my screen, bring up the slides, as a good researcher always does in a situation like this. Then I can tell you a little bit about this project. So as you mentioned, the name of the project is the COVID States Project, right? And the COVID States Project is this large multi-university initiative in which we have been collecting data about the opinions and attitudes of Americans since pretty much the beginning of the pandemic. This has allowed us to track the spread of COVID as well as various health-related, social, economic, and political consequences of the pandemic. Our project first launched in March 2020, and the team behind it was and still is an interdisciplinary group of researchers with expertise in areas like political science, communication, epidemiology, mental health, computational social science, network research, and public opinion surveys and polling. And we decided to launch this project because, in particular, because we were worried about the lack of local and state level real-time data information about COVID-19 and about its impact on communities and its impact on the public attitudes about everything that was going on. So we were really hoping to help inform and improve the national response to the pandemic. I'm going to try and change a slide now. Let's see if we can see that happen. Yes. Sometimes I do it wrong and then my Zoom decides not to show anything. Perfect. So how do we collect data for this project? Our data collection includes large-scale longitudinal surveys with respondents from all 50 states and Washington, D.C. We generally look to recruit between 300 to 500 people per state. We also have national augments for oversampling various minority groups. And although our survey waves are usually between 20 to 25,000 respondents per wave, we get our participants from online panels, and then we spend a lot of time, I personally spend a lot of time trying to make sure that our results will be representative, which is not always as easy as we'd like it to be. And so over the last 4 years now, we have collected 29 waves of data collection. We're on wave 30, launching actually today. And then during this time, we have collected over 500,000 responses with over 400,000 Americans. Some of our participants are repeat respondents. They come back to us wave to wave, and some of them are new every time. We have several network scientists on the team, myself included, and we asking those network questions, those network-based survey questions allows us to evaluate the impact of the pandemic and other things that are going on, not just for the participants who take our surveys, but also for their social environment, for their social circles, for their households, for their personal networks, and for their local communities. And then we're able to also make state level predictions, which has been very helpful. In addition to self-reported data from the project, we also collect social media data from our respondents, from people who have agreed to give us their usernames and allow us to look at their public content. We also have a smaller sample of respondents who were recruited to install a browser add-on. And that's a software that lets us track people's online behavior. So what sites they're visiting, where they get their information, what search terms they're typing into Google, and so on and so forth. The research team, so we're focusing here on teams. Our team is located at 4 separate universities. So we have people here at Rutgers, we have people at Northeastern University, Northwestern University, and Harvard University. And throughout the life of this project, we have had wonderful institutional support from all 4 of those universities, which was very helpful and instrumental to getting this done. Various aspects of our project have been supported by funding from the National Science Foundation, the Knight Foundation, Russell Sage Foundation, and the Peterson Foundation. So different pieces of the project have received funding and support from those places.
Can I ask a question?
Oh, yeah.
So maybe you said it and I missed it, but where did you, how did you recruit the respondents, or did you sample and then approach respondents, or, where did they come from?
Right, so we use an online vendor called company called Pure Spectrum, and they have a marketplace where multiple online panels participate, and we're able to recruit respondents from all of that. And that has been very helpful because we want to get state level respondents, and different vendors have representation in different parts of the country. So we were able to select from those different sub vendors and use their online panels. So this is all through online panels, and the main vendor we use, the marketplace we use, is a company called Pure Spectrum.
Thank you.
In addition, we also have a smaller sample of respondents that come from a project called Volunteer Science at Northeastern University, which is a great online project where people can go and donate their data. So they can opt in to participate in various social scientific experiments and survey research. They can opt to share with us social media data and so on and so forth. And so we have a smaller subsample of respondents also coming to us through Volunteer Science. So we combine all of those samples. We have state-based quotas for the respondents so that we are seeking state-level representativeness there. And then after we get all of those different samples, we mix them together and we start processing the data and reweighing it to make it as representative as we possibly can. And it can be a challenge with an online sample, but as I will show you, we think we're doing a pretty good job. Great. So let me tell you about the goals of the project. And so we have one key goal that we had from the beginning was to be able to help practitioners and policymakers and the general public to make informed decisions about the pandemic. And so we were working, for example, to get information to local and state and national governments in the United States to help them to distribute, to allocate their resources more effectively. A second important goal of the project was to collect data that would help build epidemiological models that could help predict the spread of COVID-19. And then we are also social scientists, and so a lot of us are, and so we're also conducting social science research within this project. And a lot of what we're looking at is the short-term, the medium, and the long-term consequences of the pandemic, right? And so we know this was a very disruptive event. It changed everyone's life in just a wide variety of ways. And then some of its consequences are short-term, they're here and they're gone, but some of them are potentially irreversible or really long-term. And so we just wanted to understand and be able to inform, decisions for future strategies when we encounter something like that again, right? And so, for example, one of our PIs is a psychiatrist, and so we've been tracking how the pandemic has affected mental health, especially among young people, and those effects are seemingly persisting over time, so that's troubling. Some of us who are doing network research are interested in things like social isolation and how the pandemic has changed the way in which we connect with other people. And whether those shifts have receded now that the pandemic is not quite done, but we think of it as mostly behind us. And we've been tracking those things over several years, and we can clearly see what the trend lines are there, and also things like socioeconomic inequalities and other types of inequalities in how people bounce back from all of the challenges of the pandemic. That has been a major thing that throughout all of the topics that we've explored, it always emerges, unfortunately. This project goals, the specific topics that we've covered. So those are topics that we ask questions about and that we've written reports about and papers and things. The topics that we've dealt with include things like a variety of health-related behaviors, so things like vaccination, social distancing, mask wearing, testing, and we look at also barriers that could prevent those behaviors or have prevented those behaviors, as well as the inequalities in access to some of those. We've looked at public approval of key COVID policies, right, around the ways in which states and the national government have handled the pandemic. We collect data on the sources of information about COVID-19, and we collect data on various misperceptions, beliefs in misinformation about COVID-19. We collect data on mental health and social isolation, as I mentioned. We collected data on back when that was happening on school closure and on online education. Very importantly, we collect data on trust in public figures and in institutions. And then we collect data and do research on American politics and elections, and on things like protest participation during the pandemic, right? So we actually did write a short book on the protests, and that one is coming out soon. It's being published by Cambridge. So we're excited about that. And so you can see that this is a whole range of different topics because our team is quite diverse and our interests are diverse. And so in addition to just focusing on health behavior, we're also looking to evaluate things like how did information and communication happen during the pandemic? How were the information needs of Americans met during this crisis or not met, as the case might be? What are the sources of information and misinformation? What is the respondents' knowledge of critical guidelines, and what is their trust in various social and political institutions, and so on and so forth. So all of those good things. And we have a wonderful team. So we are here today to talk about teams. I've been really enjoying. So this is it's a little weird to say, but this has been the highlight of my pandemic, right? So in the midst of being stuck at home and just having everything crash around us for several years. It's been great to be able to work with this absolutely phenomenal group of people. So we have in the project 7 primary investigators. Other than me, in alphabetical order, we have Matt Baum at Harvard University, Jamie Druckmann at Northwestern, we have David Lazar at Northeastern University, we have Roy Porlis at Harvard Medical School, we have Mauricio Santillana at Northeastern University, and John Della Volpe at Harvard University. And their training spans the gamut of political science and epidemiology and mental health and communication and so on. We also had 3 great postdoctoral fellows who each of them is now moved on and working as an assistant professor at a great institution. So those are John Green, who is at Duke University, Christine Luns Trujillo, who is at the University of South Carolina, and Alana Safapur, who's at Gettysburg College. And then we've had 10 doctoral students, I think, have been involved in the project. The ones that are with us now most actively are Hong Q, Alexi Quintana, Jonathan Schumann, and Atta Uslu. And we've had, and there, unfortunately, I didn't have all of their pictures, and there's a lot of them. I think we have over 20 undergraduate students who have been involved in the project, and they have been amazing. So given how challenging their experience have been during the pandemic as undergraduate students, they have really contributed a lot to this. And so a major part of this project in this collaboration has been, working across those various groups and mentoring and training people is also a crucial part of any large project like this, right? In terms of outcomes of the project, so at this point, we have published over 100 public-facing reports. And if you want to read all 100, they are available for your reading pleasure on covidstates.org. So head right over there. They cover all kinds of important topics, the ones that I mentioned, and things about the pandemic and its consequences. I apologize, I live close to the J&J headquarters, and so we occasionally have helicopters flying by. So if you can hear the noise in the background, that's what's going on. And so, yes, so we've published a lot of reports. We have published, there's probably over 20 papers now published, peer-reviewed papers published using our data. Our team also shares findings directly with federal and state and local government representatives, with public health officials. We have prepared briefings for the Office of the Surgeon General. We have provided information that was requested from us by state government representatives from New Jersey, New York, Massachusetts, Delaware, and I'm sure others that I'm missing now. Our data has been used in epidemiological modeling by the CDC. Our work has been featured in local and national news, including in major outlets like the New York Times, Washington Post, Wall Street Journal, NPR, CNN, and others. And so we feel like we managed to accomplish at least partly the goals of our project that included producing immediate, almost real-time insights and spreading them out pretty fast to people about vaccines, about testing, about all of the relevant things. We are now focusing at this stage less on the reports and the communication with the policymakers, giving them immediate information as the crisis is subsiding, and focusing more on the long-term stuff and the academic research. One really cool thing that was an outcome of this project that we did is that we developed a class called Pandemic Policy and Public Opinion. And that was really fun. That was really relevant and involves training and involves education. And so we did that a couple of years ago during the pandemic. And the class basically used the pandemic as a case study to look at social issues. And so we would combine the classic theories that we teach students with insights from the data of the COVID states projects and do it that way. But the really fun thing was that we did the class at the same time at 3 universities, right? So I did it as a doctoral seminar at Rutgers, and Matt Baum did it at Harvard, and John Green did it at Northeastern University. And we were in all of those different locations, but like coming together at the same time every week and virtually kind of teaching together to the students who would sit in different classrooms in different places. And it was a little complicated to put all together, but it ended up being a really cool experience. And I think the students enjoyed it. So that's one interesting part of the project. A couple other things that I wanted to share. So one thing that we have developed as a resource, and that was especially useful when the pandemic was really in its height, was the variety of dashboards that allowed people to get interactive access to our data. And so, for example, we developed this dashboard that you're seeing here, which shows vaccination rates by state over time. So that's on covidstates.org. We're still updating it. And this is information that seems relatively straightforward, but it's really important. And it turns out it's not as easy to come by as one might hope. Because, for instance, we've been working recently on making sure that the vaccination rates that we're capturing are correct or as close to ground truth as we can make them. And so we've done a lot of work to compare our data to other sources. And for instance, one of those other sources is the official CDC data, which is based on reports from state institutions. And here, so you can see our data is the blue line and CDC is the black line, and the two track very well together until we get close to the end of 2021 when COVID booster shots were approved. And what's happening there is that unfortunately the CDC data is not very good at that. So CDC data is better at linking records of multiple shots that people are getting for the same person. So they would see someone who's getting a booster shot and they would not be able to link that back to them having a vaccine already and would mistakenly count them as a new person getting their initial shot. And so in some places they were getting over 100% vaccination rates. So they were overcounting the initial vaccines and undercounting the boosters. And so one good thing about our data that makes it useful is that it doesn't have some of the challenges that administrative record data might have. It has other challenges, but the biases are different. So it's a good way to better understand what's going on closer to real time. We've done similar analysis to see if we were estimating the prevalence of COVID infections, over time, and we track pretty well there with other benchmarks like wastewater data and things like that. So vaccination, something we've been looking at a lot. Speaking of interactive dashboards, we have another dashboard that it used to be extremely helpful. Now it's interesting for historic reasons more than anything else, but it shows state by state behaviors and attitudes of our respondents over time. And so those are things like social distancing and mask wearing and following CDC guidelines and approval for lockdowns and other measures that the government had imposed or considered. So we were tracking those and we were sharing the data. My favorite dashboard or kind of favorite question that we're studying right now has to do with trust, right? So I mentioned some of the things that we are looking at include trust in social institutions, trust in science, trust in medicine, trust in democratic institutions, sources of information and misinformation about COVID. And we know that in recent decades, trust in institutions is in decline in not just in the US, but across Western democracies. And we also know that trust has a huge impact on people's behaviors during the pandemic, right? It's in our research, it pops up as one of the strongest predictors of things like the decision to get vaccinated. And or staying socially distant and things like that. And so we have this dashboard that looks at trusting various institutions, the government, the media, scientists, and medical professionals. And we've been tracking trends in trust during the pandemic. We still see very high trust in, for example, doctors and scientists, but it has declined a little bit over time. Right. And one thing that we have found over and over again in various parts of our research is that people tend to trust individuals more, like their personal doctor. They trust more than institutions, medical institutions like the CDC or the FDA. So trust is another thing we've been tracking and sharing out for people who are interested. Another dashboard, which is now, again, a little outdated, but still interesting to look at, is the Twitter dashboard, which let us track information and misinformation on social media. And so it would basically show what kind of stories or news domains were percolating on Twitter. And it would also show the demographics of who was sharing that information, which was very interesting. And this is all thanks to a large panel of Twitter users that were matched to voter files that our Northeastern team is tracking, right? So these are kind of our dashboard and the available resources. I can pause here and we can move on, or I can give you some examples of papers and projects, whatever you think would be most useful.
I do have one question, Katya. This is so fascinating, and I've read so much about the research, but hearing your presentation just shed some really interesting insight on like your process. When you think back to in a team science perspective, sort of the catalyst for this, so how to convene a cross-institutional study of this magnitude during a time of profound disruption, nationally, globally, societally. What are some of the broader insights or things that worked particularly well for how this group worked together to just convene all of these moving parts during a period of such uncertainty?
It's a very interesting question because basically this uncertainty was the impetus for convening people together. I don't know if we could have done this kind of project without the pandemic, because we were we were all basically sitting at home and being worried about what's going on and being concerned that we were not seeing enough data, especially beneath the national level, at local and state level, that decisions were being made, but like they didn't seem to be based on, always on the best data. And so this is kind of the drive for the team to come together. We were just discussing this, and we were talking about how it'd be nice to actually measure some of this and understand how it played out and how it happened. And so and the other thing was that the pandemic kind of required for the team that came together to come together in a way, if I can phrase it that way. It's just that as a phenomenon, it's so complicated that you need people to come from a bunch of areas. So it has implications from individual to community to society, and you have to look at it from multiple perspectives to be able to truly answer some of those complicated questions about it. And so it seemed like a multi-institutional, multidisciplinary team would be helpful. So we wanted to know about a large number of things. We want to know about epidemiology, right? We also wanted to know about mental health. We wanted to know about political implications, economic consequences. We wanted to be able to make policy recommendations, right? And understand all of that. I was personally interested in the spread of information and misinformation and the disruption of social networks and how people are connecting with other people. And so just to cover all of those things, we kind of needed a group where everyone comes from these different perspectives. And it sounds, I know that for people who come out of health, it might sound a little weird that we have a group that includes health researchers and then political researchers, but like politics and policy were at the core of the decisions. In this pandemic was so, things were so interconnected. They really were, and being able to tackle both of those sides of what was going on seemed really important. Yeah, sorry, Nancy.
Yeah, no, that's fine. So did it start with just a few of you that had an ongoing relationship, a collaboration, and then you just added people that you thought you needed, or did you all know each other before? And how did you, how did it work? Like at the very beginning?
Yeah, so I was talking, so David, Matt, and I were the first three people that started to try and do this. And so we decided, we were talking about the challenges around this pandemic and not having enough information, and we were looking at launching this survey project, and we applied for a rapid grant from NSF to try and really quickly get this off the ground. And so it was very quick. We were talking about it, one day, and then we were all kind of stuck at home. The pandemic was going on, and we started working on it, figuring out how we could design the data collection process so that it would happen at the state level, and then getting it off the ground, and then started pulling more people in. So the three of us none of us are health researchers, so we knew that we needed that expertise, because as interested as we were in what was going on, epidemiology was not quite our thing, and neither was mental health. And David is in a network lab. David Lazar is in a network lab at Northeastern University, where he works very closely with Alex Vespignani, who does epidemiological research. And so around all of those things, we all had connections to some other people that we thought could be could come together around this project. And then over a little bit of time, we ended up with the 7 PIs that we have now. And it has been great just working with this very diverse group of people coming from very different places.
If I might ask, this is really helpful to understand kind of the genesis and the building of this team. And you're kind of discussing some of the the needs for people who have different forms of expertise with different perspectives. Can you talk a little bit more about the experience of working on this really multidisciplinary, interdisciplinary team and the advantages that the project has benefited from over time, and also some of the challenges that this interdisciplinarity has created?
Right, and I know you've had some fantastic speakers in this series that have talked about generally the benefits and the drawbacks of interdisciplinary research. So I can talk a little bit about how it played out for us. So one of the main things was that, as I mentioned, we thought we needed expertise in all of those different areas because the pandemic was so complicated, and trying to answer questions about the link between policies and behaviors and attitudes was required quite a lot of input from various disciplinary areas. So that was one thing that I think worked out for us. We were able to also, in addition to what I think every interdisciplinary team will talk about, which is being able to pull expertise together, we're also able to reach different audiences, I think, with our work, much more so than each of us individually could have reached. So because we came from those different backgrounds, so having people from health and communication and political science made it possible to speak the language of practitioners and public health officials and political actors, and connect with agencies, and I think more successfully than probably any of us individually could have done. And you observe that in many cases we're having conversations where you kind of get an insight that you wouldn't have had. You're like, oh, that's how this works. I understand now. This is how this works in health, right? This is what happens in health research, or this is what happens when policies are getting decided and things like that, right? And that has been really useful. That has been helpful. We've been able to tap into different resources as well beyond just expertise. Those would include things like different sources of funding, right? Even that one basic thing is with a large project like this, different pieces of the project need funding to work, and so being able to tap into multiple different places where funding for something like this would be available is useful. Different technical knowledge about methods and how things work and how institutions function. Different social capital, basically different connections to various external actors and organizations that each of us had, that had to be mobilized to get this off the ground. That was useful. We also had quite methodologically were quite diverse as a group, so we were doing different things methodologically, and that came in quite handy, because it turned out, as we were we thought this would be like kind of a standard polling project, but as we worked on it more, it became much more complicated. There were computational elements and social media data collection. There were qualitative elements and qualitative data processing. And so having those different capacities within the research team was also very important and useful. Challenges, you mentioned, also talking about the challenges of an interdisciplinary team, and what typically people would say, I think, is that those kinds of teams have higher coordination costs, so that it would be more difficult to speak each other's language and things like that. We did not actually have that problem in this particular team. The internal communication was quite smooth because we already had some dyadic connections. So pretty much everyone in the team, I don't think we had anyone who was a brand new person. Everyone in the team knew someone else on the team. So we weren't the cohesive team. We didn't all know each other, but we knew how to communicate and coordinate with each other in advance to some extent. And normally, I think the pandemic again was very important there, because normally you'd expect some friction to potentially come when people make decisions about priorities, but the pandemic is very clarifying in terms of like, what are our priorities now? It speaks very loudly to like, here's what's going now. People need to get vaccinated, or we are recalling a vaccine, or something's going on. And so the priorities were a lot starker and clearer than they might have been. Yeah.
Could I ask there, because that insight prompts a question for me. Given the sort of evolution, and you mentioned a little bit about sort of the evolution of the study as the pandemic and its implications have shifted, how are you as a team sort of thinking about the next chapter of the COVID States project as the public health dimensions evolve with the pandemic?
Yeah, absolutely. So we're now spinning off a few different things. One is we're trying to continue tracking, because we have trend lines that are quite useful, not just for COVID, but for health behavior in general. We're trying to continue that part of the project. We think it's helpful for epidemiological modeling beyond COVID, and we're keeping that going. At the same time, we have been doing a lot of work in the past on the intersection of politics and the pandemic. We're switching off to some extent our energy to focusing on more political issues. So, for example, now our team is doing quite a lot of work around the 2024 election. So we're doing social science, political science type research around that. But one of the big things that we're doing that I'm especially excited about, and that actually might be of interest, is that we have a new project called Chip 50 that includes a lot of the same people, where we're taking what we learned from the COVID States project and we're applying it to try and create an open infrastructure that would allow people to submit survey modules, and we could fill them for people in all 50 states. And so this is an NSF-funded project where diverse researchers at all stages of their careers, working in areas of health, politics, economic stuff, and things like that, can send in a proposal that includes a survey module that for some reason needs either a very large sample or else a sample in each of the 50 states. And we have external reviewers that review these, and when they get the ones that get approved, we add to the survey and we field them for people, and we return the data to them. And so because we had to learn so quickly how to do this, and then we tried to perfect it for 4 years, we've now reached the place where we know how to run 50 projects in each state and then pull the data together and then crunch it together, how to clear the problematic respondents, how to remove the bots. Now we're dealing with, LLMs, like large language models, and we're trying to think now about how those will potentially impact data collection when they start taking our surveys. And so we were using the methods that we learned from the COVID States project to make this new thing happen that we want to open up to people to use.
It's so interesting. Thank you so much.
Mm-hmm.
Are we looking at any more slides? Because we can take that off and see each other.
Yeah. Sorry about that. No more slides.
So I can imagine you're always applying for funding.
Right.
I mean, NSF is what, a couple of years usually, or something like that?
Yeah, we are. We currently have a grant going out, and our current work is funded by this NSF grant that was specifically for opening up the infrastructure. So this is what we're working under now. There's a separate grant from the NIH that that's part of our team that is focused on mental health. So that's kind of a separate project. There's a multiple projects now that are offshoots of the initial COVID states project that include some subset of the same people. And so we're trying to push all of those various things forward, and see in what ways we can be useful with what we figured out. So non-probability online panels are an interesting but kind of difficult thing to use well, and we're learning a lot from these projects, and I think that's partly why we have been successful in getting funding that we can stretch out, because the type of polling that we do is a lot cheaper than what probability surveys usually cost, or phone surveys.
So, I mean, you've commented on how well the team has worked, and clearly it's incredibly efficient and productive. So can you talk a little bit more about the approaches, the strategies that you've used to facilitate communication and effective teamwork, not just among the investigators, but with all the data scientists and staff and trainees?
Yeah, we've had to, over time build that out, because we started with fewer people, and then the project started to grow and the work started to grow, and it has been I come from communication, so my discipline is communication, and I think that part is really important. So consistently communicating, and keeping those lines, organizing that infrastructure, keeping those lines open. So our communication around this team has been quite intense. So we have 2 meetings a week, and we're daily on Slack. So we exchange messages pretty much all the time. I see some of those people more than I see, close friends. They are all close friends at this point. We've spent a lot of time together around this work. We enjoy each other's company. But so we had to have very intense communication to make sure this happens, and we, especially during the early days when it was taking off, we were constantly staying in touch. And in the beginning of the project, we were really pressed for time. We did not, we hadn't planned out everything. We were rushed because we were like, this is happening now. We have to go get it done, and kind of share the data and the insights with people. And as we started working more on the project and building it and developing it, we started having more effective structures, and so more effective strategies for organizing data or sharing data, more effective documentation. We developed a more effective onboarding, the ability to bring because the project has gone on for 4 years, people get in and out of it. So any long-term project has this. I'm sure you all are working in the same kind of context where that happens. And so as you find out sooner or later that the procedures or the ways in which you bring a new person in are going to be important, that requires careful work to kind of document what's going on in the entire project, so that a new person doesn't have to be lost as they are starting out. We've kind of had a very flexible work structure where we have basically you've been able to work in various teams and subgroups of this, and you'll see that a lot of the tasks that are getting done are done by some kind of subset of everyone involved, depending on skill set, depending on various resources, including time, which has been a crucial resource. And so in the first year of the project, we were spending enormous amounts of time on it. And as it grew, we kind of had to scale back and like do some other things, like have lives and all of that good stuff. And so managing the time that each person spends on various tasks has gotten better over time, and we've been able to structure it, organize it more efficiently, and also have more formal organization of like writing out some of the expectations, making sure that the expectations are clear. So having documents that say, here's what we do, and here's what happens, and here's what the outcomes are, and like here's what is expected, and so then people can know in advance all of those things. And we still, it's in no way perfect. It's still a messy process, as I think every project of this kind probably is. And if there's one that isn't messy, I'd love to see it, but so far I have not encountered it. But yeah, so I don't know if that answers your question or any question really. But yeah.
I think this is such just a fascinating example of team science. And I have a quick question on the content real quick about looking at trust of institutions. Will any of your future studies look at the declining trust of higher education and public perceptions of trust in academic institutions?
We just added this wave. We had not looked at higher education because we were focusing on trust. Well, actually, we had a couple of survey waves where we looked at trust in higher education. When we were specifically focusing on a sample of younger Americans, so college-age Americans, we had a few survey waves where we asked specifically college students about their trust in higher education. This is the first wave going out today, is the one where we actually started asking everyone about their trust in universities and higher education, because a lot is going on right now with universities that is, challenging and problematic and interesting. And so we weren't focusing so much on that in the context of COVID, except for young people's attitudes towards their institutions. But that's a great question. We are starting to do that just now.
I can't wait to read the results.
Me too. I don't know if we'll be happy about them.
So are you letting people of all adults of all ages participate, or is there any age restrictions?
So we have quotas for age. Age is 18 plus. We don't have minors in the sample. Our RAB is for adults only. And that's another thing, by the way, speaking of challenges, interesting challenges with projects for universities, IRBs at 4 universities, that's a magnificent thing to organize. I'm sure it has happened to all of you, this multi-institutional, interesting, fun challenge. But so we have state-based quotas. So for each state, based on census, we're modeling our sample based on state demographics.
No more questions for me. I have a lot of questions, but no more for this forum for me.
No, it's fascinating. It's really fascinating. You're studying so many interesting issues.
Well, I guess I might have, one more question. You mentioned the various trainees, the course, that's really kind of interesting model of course across multiple institutions. Have you been intentional about teaching about things like, collaboration and communication with the postdocs and other trainees working on the project to kind of, build their skills to lead these kinds of projects in the future?
That's a very good question. I don't know that we've necessarily been intentional um in structuring that in a way where it's like, here's how we take how you take a project like this off the ground. It's more learning by doing.
Mhm.
They have been very heavily involved in everything we do, and we have a very democratic team, so it's not very hierarchical. We're all kind of sitting around and we're having these Zoom conversations where decisions are made, and pretty much, we listen to everyone's opinion and they can weigh in, and a lot of the time, regardless of whether the person is a PI or, a student or a postdoc or whatever, we just have brilliant students and really, really great. Our postdocs were tremendous. They're all superstars, and sorry if I'm bragging too much, but like that's the truth. I'm not making this up. And so they have contributed so much to this project that I think just doing that, and then they also see the downsides and the challenges of the organizing. So I'm sure they all go away with some notes of like, here's what to do and here's what not to do. And we have these discussions a lot of the time that naturally come around about what is the best way to apply for funding and what is the best way to strategize sending papers out for publication. And so without kind of being intentional about training people, I think these are conversations that naturally happen. And we have some very successful senior scholars who are sharing their experience with everyone, myself included. I have learned a whole lot from other people in the project. So I think it played out that way, but you're right that it could be made a lot more explicit and intentional. This kind of more structured learning about teamwork and communication and structuring leading these projects. It's a great point.
Well, I mean, it takes nothing away from the incredible success that this project has been, and frankly, so important and impactful at so many levels. So I think, we just want to thank you for taking the time to share with us, your experiences, your expertise, and your insights into, collaboration and this just really impressive work that you've done and are continuing to do. And for those who are watching today's seminar, thank you so much for joining us. And if you have other questions about team science, about collaborations, about your own projects, or would like to see some of the other seminars, please visit the NJAX website, the Team Science Core. We have other seminars that are posted there, and you can also request a team science consultation. So thank you so much for joining us.
Thank
Thank
you.
you.
Thanks.